Such a nice day at Butler Park.
Yeah.
God's blessed us.
You guys want to play some basketball?
Yeah, sure.
What started out as a nice day at Butler Park quickly took a turn for the worse as sports injuries plagued their day. Watch to see how these injuries affected these people and how it affects athletes as a whole.
Oh my lord. Oh.
Concussion, also known as mild traumatic brain injury or MTBI, is an effect caused by a blow to the head where violent shaking of the brain occurs, forcing it to bounce around the skull and impact with it rapidly. These injuries occur in sports primarily, with 1.6 to 3.8 million injuries in U.S. sports per year. Football accounts for 60% of these injuries, but almost any physical activity can lead to a head injury in one way or another. After contact, symptoms such as blurry vision, restrained hearing, or lack of concentration can occur. If this occurs, it is important to seek medical help and be evaluated for a concussion. CT scans or MRIs can help reveal the extent of the injury and determine whether the athlete is concussed or not. If never treated, permanent symptoms to the brain may occur, impacting the athlete for extended periods of time. In order to treat concussions, pain relievers and other medicine can be given to minimize the effects or treat the concussion. It is recommended to limit the amount of time performing activities with high concentration. It is also encouraged to stay out of physical activity until healed, as a previously concussed individual is 3 to 6 times more likely to be concussed. In total, the concussion problem is hard to be prevented, but improvements to helmets and gear could help limit the effects of a blow to the head.
An ankle sprain occurs when the strong ligaments that support the ankle stretch beyond their limits and tears. They range from mild to severe, depending upon how much damage there is to the ligaments. Most sprains are minor injuries that heal with home treatments, like rest and applying ice. However, if your ankle is very swollen and painful to walk on, or if you're having trouble putting weight on your ankle at all, be sure to see your doctor. A grade 1 ankle sprain takes about 5 to 14 days to heal. A grade 2 ankle sprain takes about 4 to 6 weeks to heal. A grade 3 ankle sprain takes about 6 to 12 weeks to heal. The key to preventing ankle injuries is to stretch before physical activity. Also, eat a healthy diet that keeps your muscles strong.
This is a dislocated shoulder, which is when the ball of the arm gets pulled out of the socket of the shoulder. This could be caused by falling on your shoulder or overthrowing your shoulder. What you will notice in this event is your shoulder will begin to swell and inflame. Then you will have to force the arm to rejoin the socket of your shoulder. After you rejoin the socket of your shoulder, the recovery will be to 10 to 16 weeks to being fully recovered. To prevent from this happening again is to stretch a good amount and avoid overthrowing your arm.
The ACL, or anterior cruciate ligament, is a ligament that attaches to the back of the thigh bone and the front of the shin bone. Its primary purpose is to hold these two bones in place and to prevent the knee from bending backwards. Unfortunately, tearing an ACL is a common injury, with around 100 to 200,000 per year reported in the U.S. This injury most often occurs in athletes and is caused by a rapid twisting motion of the knee. Treatment includes surgery and 6 to 9 months of physical therapy in order to fully recover. The most effective way to prevent this from happening is to always make sure you have stretched before engaging in physical activities, or to wear a brace.
As you can see, injuries made this day a rough one for the group. By listening to our safety advice, maybe your day will not go like this.
Oh my head, I can't see, dude. God.
My knee.
Oh my God, I can't.
Here is our work cited, addressing some of the citations that we use for pictures and for researching. If you feel the need to access any of these articles, please email us at 19reaserk@apcsd.org.